Okay, we are back live from Starbucks on Fredericks in Moreno Valley. This is Donovan and Sean, and we are local residents that are trying to make a difference in the city of Moreno Valley. And we are talking about some of the issues addressed in the city of Moreno Valley. And one of the biggest issues that was really big for Sean and myself is helping the residents that might suffer from mental health and substance abuse issues, and how are we going to address that? And Sean did a lot of research. As you guys know, the guy is a genius. He likes to stay behind the scenes. He gets facts, he gets numbers, which is a lot better than what I do. So we're going to go ahead and keep talking about this issue, because nobody seems to be talking about what is plaguing our residents. I mean, I know we have tax issues, we have all these other political issues, but the issues, if we can't address our fellow residents, we don't even have a city. So let's get into it. Now, one of my major question, how many mental health hospitals do we have?
Right now we have one in Riverside, and we have some room at the County Mental Health County Hospital in Moreno Valley, but that's usually for fairly severe people. And then we have the county hospital out in downtown Riverside, and it's not near. I checked. There was a news story recently that we have something like 17 beds per 100,000 people, and we're supposed to have about at least 50.
Right.
But if we're having only one bed for every 9 people, then that means that realistically in this county we need more like around 80 beds per 100,000 people to keep up.
Now, let me ask you this before I forget. The March Joint Life Center, they were going to address some of the issues of mental health.
There's a company called Signature Healthcare that is bought land to become part of the March Life Care Campus. Their plan is for 150 beds. And it's a company that has a track record. They've built. If they build this hospital, it would be their 14th. It'll be their 6th in the state.
Okay, wait. I'm gonna cut you off here right now. Now, one of the investors in that isn't Vinny Benvizi.
No.
Okay, yeah, because he has a record.
No, this is a company that's competent and has a proven track record.
Okay,
of being able to build things.
If you've been following Ito's brothers having a hard time. In Tulare.
And speaking of the Benzivis, what we really need right now is for Jeffrey Gaiba to quit screwing around with the joint powers to let this thing actually
progress.
Yeah, to actually see it through. Because I know Ito Benzivi has tried to throw out some rival projects, and his projects are. What he has in mind is things that insurance companies are not going to pay for. It's going to be something that people that are fairly wealthy would have to pay out of pocket for a lot of holistic treatments and stuff.
Okay.
This is and if we go with the Signature Behavioral Health, then they're a company that actually has hospitals in operation already, and some of them have a decent reputation.
Okay. So we're saying basically the city needs to start doing, at least getting us in the direction of helping the residents that might have some substance abuses. What other entities are out there that people who might not know could go and get help if they have an issue or they think?
Well, in the immediate time, there's groups like Alcoholics Anonymous, Al-Anon, Narcotics Anonymous.
So a lot of nonprofits.
Yeah, Codependency Anonymous. Some churches have Celebrate Recovery groups.
Okay, churches.
Yeah, in fact, that's something that would be the easiest thing to do right now is to get more churches involved.
Okay. I mean, but are a lot of churches aware that there's? Well, I think they're aware. They just
Yeah.
So that's a good thing. On an average, if I needed help and I went to the city, county, or whatever those, what is the wait time that to get help statistically? Is it 2 months or something like that?
I once went through the county for office visits, and it was a 6-month wait.
Wow.
And I once met someone that was held on a 5150, and legally, when they're discharged, they're supposed to have a appointment within 3 days, and they voluntary hold, it still took them a 2-month wait to get help.
Goodness gracious! And by then, God forbid, and God bless people who may have help. I'm a veteran, and the veterans are killing themselves. But there's like 2 veterans a day that commit suicide, or I think it's more than that. I think it's 20 something a day. And if you got to wait 2 months, that's a lot of people that are dropping. And I've had some buddies that have done that. So, what are some of the, in your opinion, from the statistics, what are some of the reasons why maybe some people are having issues with substance abuse and mental health? Job?
When mental health and substance abuse go together, it's they're usually trying to self-medicate. They're trying to regulate themselves with the substances available to them and what's familiar to them.
Right. And like I said, there's not a lot of jobs out here, so there's a lot of insecurity. I have, like I said, neighbors that are, they're worried about where they're going to get their next paycheck the next day. Yeah. Not everybody wants to work at a warehouse. I mean, it's not enough to pay for a house if you want to buy a house.
And also, we're going to need the county services because the jobs, especially the warehouse jobs, are not going to pay enough for people to get private health care.
Okay.
At best, they're going to get some sort of Affordable Care Act plan, which doesn't necessarily fill all the gaps.
Gaps that you need.
Yeah, and some of them aren't going to get health care at all.
So basically, it's going to be almost like corporate welfare, like what Walmart does. You'll pay a person, but it's not enough for them to cover.
Yeah, Walmart offers you health care, but 100%. You pay 100% out of pocket. They don't cover any. They don't add any.
They just say, "Here's the program if you want it."
Yeah, they don't contribute to it.
Okay, gotcha. Now, if we have this program, would that also address the homeless issue?
Yeah, it could potentially, if the city or some other group could start offering services to help pay for the homeless to get mental health services or get them connected with indigent care. There might be a way to, it might require a bit of a waiting period there too, just to make sure that it's not make sure it doesn't people don't assume it's like a new freebie to be handed out. Because we'd have to be very, very careful if there's not. It's only to mental health care, like counseling and medications. In many cases, it would be a shot. Because if people get the idea that there's other things to be gained besides medical care, then we're going to have an influx of people. Right.
A lot of people from San Diego coming in and just saying, "Hey, this is a freebie. We could come up here and grab all this."
But also the benefit of trying to get some homeless help is that it might eventually be possible to get some of these people back in contact with families and get families willing to help them again.
Oh, absolutely. Now, if the city council adopts this, and and this program is something that we can do, how do we regulate it? Do we put a board up or an oversight committee?
We could already use an oversight committee. Well, not necessarily so much an oversight committee as an advisory committee that would work with the senior citizens, the disabled, mental health, substance abuse, basically groups that have a lot of contact with emergency responders and try and get the emergency responders better education to how to handle it or handle this better. It wouldn't be if someone gets shot, we wouldn't be there to criticize the cops and play Monday morning quarterback. It'd be okay, what happened? How can this be improved in the future? Because a lot of this would also be a public safety issue, because if we could get substance abuse down and have the cops as the front line of help for psychiatric issues, then that would reduce the burden on law enforcement. Because let's say the cops get a call for someone's acting out and they think it's a psychiatric issue and they get a 5150 call. Well, does that require one cop? Does it require 3 cops? Does it require shutting down a freeway and a bridge to try and get someone off of it? That gets expensive and takes a toll on the availability of police to cover the rest of the city.
Right.
And by the time it gets to that point, inpatient services often run around $1,000 a day.
Yes.
And that's not, and then there's whatever the cost of taking someone to the emergency room is. I asked my sister-in-law, who's a nurse, about emergency room costs, and she said that hospitals are very secretive about to where they don't even want the nurses to know.
Wow. So hypothetically, let's say we get this program going. Now, wouldn't this also address the disabled employment? Wouldn't it address that?
It would help connect people to services. It would help show a need, and it would help us to recruit services, whether it's a sheltered workshop or whether it's companies that can accommodate disabled people, which certainly won't be warehouses or other businesses where performance is judged by a quota on a computer and a computer can't provide reasonable accommodation.
Right.
But just having an advisory committee would provide opportunities to connect resources to the city and connect police to the resources to help guide people to resources when possible.
I think that's a great idea that we have. Are there grants available that partner with the county maybe or the federal government we can get?
George Price is currently working on getting some grants for a couple of local nonprofit groups. But it doesn't make any sense why the county does not have a county mental health office for office visits in Reno Valley, because we're the second largest city
in the county.
We've got offices in Paris, Elsinore, Hemet. We've got a bunch of offices around us, but not in Reno Valley. And the nearest one I can think of is over by UCR, but
right.
Even then, if someone needs to get there by bus, that's like, a 2-hour trip?
Yeah. Depending which bus line you're on and stuff like that. So, to close this up, you've done a lot of research on it. We're not, and this isn't just a one-time thing that we're going to visit this. We're going to talk about this because if you read a lot of the Moreno Valley Police calls and you read their log, a lot of it does have to do with people that might have mental issues or are on substance abuse, and that takes up a lot of their time to just deal with that person. So, and we're not here to down anybody because you're on medication. A lot of people are dying from prescription medication. So, we're trying to keep the costs down, keep everybody safe, and get everybody the help that they need. If there's nothing here for these people that want help to get it, what are they supposed to do?
That's a good question. Nobody likes dealing with alcoholics and druggies, but right now they made bad choices, but right now there's really nothing to help them change their choices and turn their lives around. I think we need to make those opportunities because it's not productive to throw them in jail forever.
And that costs money.
Yeah, that costs $50,000 a year per head.
Right. So we're going to cut to a commercial. We're over here at Starbucks in Morale, right off of Fredericks Boulevard. If you want some good coffee, good conversation, and some good people, you need to come on down and visit. This is in the new First District. I'm Donovan, and this is Sean, and we're going to go to break, and we will be right back after these messages. We've got to pay a few bills, so just enjoy.